Once again, our topic, universal health coverage, should be the federal government's responsibility. And arguing first for the motion, Paul Krugman, a well-known op-ed columnist for the New York Times. And I want to point out that in an era when many of us were beginning to refer to our potatoes as freedom fries, Paul Krugman stood up and talked about the French when it comes to health care, in some ways doing it better than the United States, and the Germans, and the Koreans. Paul Krugman, the podium is yours.
I'm an economist, which means I'm supposed to talk about efficiency. But I actually want to start by talking about morality. And in fact, I don't want to start by talking about health care. Let me talk about something that's going on right now. As we sit here, there are several million people in the Houston metropolitan area who are without electricity or running water. They've been hit by a disaster. They didn't do anything wrong, so they stayed in their houses because that was what they were advised by the governor of Texas to do. It was the right thing to do, given the impossibility of evacuating a city that size. And now a lot of them are in trouble. Some of them can manage. Some of them can now go and stay with relatives. Some are in good health. And others are not. They're in a lot of trouble. Now, do we think that the people who are in trouble, who are elderly, who are in poor health, who just don't have the financial resources, whatever, to get themselves out of that situation, do we believe that, well, look, it's not a government responsibility to help them. They should be left on their own? Well, of course we don't. I imagine there are some people who do believe that, but not many. They certainly don't show their heads in our American politics. We do believe that if our fellow citizens suffer misfortune that is no fault of their own, and we can help them, that we should. Now imagine some American who is in poor health and can't afford medical care. Some American who is elderly and in need of trouble, or maybe not elderly. Something's gone wrong. Someone who is trying to work but can't get a job that has health insurance. Someone who is in difficulty. Do we believe that that's their problem, that we should not be taking care of them? And by the way, we're not just talking about the 45 million people without health insurance. We're also talking about the roughly 75 million people who have inadequate health insurance that basically crumples whenever it's put to the need. We're talking about a large part of this country that does not have adequate health care coverage. Well, I would submit to you that actually as a nation, we don't believe that it's appropriate to leave these people on their own, that we actually believe that the right thing to do is to help people. We don't think that people should be protected from all of the risks of life, but when there is something you can do, we believe that we should do it. And in fact, by and large, if you ask people, should people have health coverage in this country? Should people be guaranteed health care? Most polls I've seen say that a heavy majority of the public thinks that they should. So then the question would be, well, how is it that we don't actually have that? How is it that we haven't actually taken care of our citizens in the way that overwhelmingly, as a nation, we believe is the morally right thing to do, that as a matter of values, we think we ought to do? And the answer is, of course, that we're told two things. We're told, first of all, that we already do it, that we already take care of everybody, and we're also told that it's impossible to take care of everybody. Now, you might think that it was impossible to believe both those things at the same time, but that's why these guys are paid the big bucks. So we're told that, well, look, and I can quote the president there, people have got access to health care in America. After all, you just go to an emergency room. And of course, I think we probably have a fair number of doctors here, right? It ain't the same thing. First of all, going in an emergency is no substitute for continuing care. And secondly, if you go to an emergency room, they will bill you. Now, if you're indigent, you'll get the care all the same, but if you will get the bill. And if you're indigent, maybe that doesn't matter, but for working Americans who don't have good incomes, they're terrified of emergency room coverage. And there's something sick about our debate that anybody can even claim that the emergency room is a substitute for universal health care. But the other argument is that it's impossible, that if you try to have some form of universal health care, it'll be terrible, it'll be lousy quality, it'll be wildly expensive. And so people are told that, a government insurance system can't possibly work. It will be lousy insurance, it'll be awful, it will lead to awful care, which now we're going to hear a little bit, I think, later on about some of the international evidence. We're going to hear about other countries. But, there's a secret. I don't know if people know about it, but, there's this program called Medicare. Covers every American 65 and older. It is horrors. It's a single payer health insurance system run by the federal government. When it was being proposed, people said it would be terrible. You may have heard of something called Operation Coffee Clutch, or you may not have heard of it. Doctors' wives were urged to hold coffee clutches in which they would try to convince the doctor's patients what a terrible idea this proposal called Medicare was. And they would play a recording by a fellow named Ronald Reagan explaining what a terrible idea Medicare was and how it would lead not only to destruction of health care, but actually to the destruction of freedom. It's quite something. You can listen to it online. And at the end, basically, Medicare is the route to a totalitarian state. Well, it's become as American as apple pie. Famous quote in the healthcare field is the constituent who accosted Senator John Breaux saying, "Senator, don't let the government get its hands on Medicare." The fact of the matter is we have universal health coverage for our elderly already. The other thing that people say is that it would be impossibly expensive. Now, the truth is, little known, other big secret, really have to go in deep research and actually look at a couple of official statistics that are easily available to find this out. In this country, the government already pays more health care bills than private insurers do. Medicare and Medicaid together are already a bigger program than private insurance, all private health insurance. The reason is that we already cover the expensive cases. We already have the expensive cases, the elderly, the very sick who end up being bankrupted and therefore end up poor enough to get Medicaid are covered by public programs. What's left are generally lower income working adults, and we pay an enormous amount to not cover them. The fact of the matter is that our healthcare system is wildly inefficient, largely because we have an insurance industry that devotes enormous resources to trying to identify who really needs health insurance so as not to give it to them. And we have healthcare providers devoting enormous resources fighting with the insurance companies to actually get paid. And the result is a wildly inefficient system. It would be cheaper by far to just cover everybody. We pay this huge price because we've managed to convince ourselves, or be convinced, that somehow something that every other advanced country does and that that we do of ourselves for the elderly is impossible.
Paul
Thank
Krugman,
you.
thank you very much.